mark that. That's the first time that I waited for the recording in progress announcement before I started talking. So even I can learn. Welcome everybody. I'm Steve Levitsky, Director of the David Rockefeller Center for Latin American Studies at Harvard. Welcome to our first Dr. Class Tuesday webinar of the semester. Before going any further, I want to thank our wonderful team of Pao, Jillian, and Gabrielle for making this event possible. I also want to introduce my two co-hosts, Professor Frances Agopian. Fran, you want to say hi?
Hi, and welcome everyone.
And Alicia Holland.
Hi, everybody. Welcome.
So in today's panel, we continue our look at the consequences of the COVID-19 pandemic in Latin America with a terrific panel entitled Latin American Prisons, Challenges and Opportunities from COVID-19. We've got three outstanding panelists. Let me briefly introduce them. We also have an outstanding discussant. The panelists are Benjamin Lessing, who's Associate Professor of Political Science at the University of Chicago, together with Paul Stanlin. He directs the program on political violence at Chicago. Professor Lessing's research centers around criminal conflict, organized violence involving armed groups that do not seek formal state powers, drug cartels, prison gangs, and paramilitary groups. His first book, Making Peace in Drug Wars, which was published by Cambridge University Press in 2017, examines armed conflict between drug trafficking organizations and the state in Brazil, Colombia, and Mexico. If you have not read that, it is an outstanding book and I recommend it. Professor Lessing's second book project, which is tentatively called Criminal Leviathans, How Gangs Govern, Organized Crime, and Challenge the State. Let me say that again. How gangs govern, organized crime, and challenge the state from behind prison bars, looks at the counterproductive efforts of mass incarceration policies, and specifically how they fuel the growth of powerful armed criminal groups at the core of the state's coercive apparatus. Ben is currently an Andrew Carnegie Fellow, where he's finishing up that book. Our second speaker, actually, I'm out of order, but our second speaker is David Skarbek, who's Associate Professor of Political Science at Brown University. Professor Skarbek studies the political economy of institutions and institutional change with a focus on collective action, norms, and ethnic conflict. He's author of two very important books, the most recent of which is The Puzzle of Prison Order, published in 2020 by Oxford University Press. And his current project looks at the operation of informal institutions within prisons across the globe. Our third speaker is Marcelo Bergman. He is a professor and director of the Center for Latin American Studies on Insecurity and Violence, CELID, at the National University of 13 de Febrero in Argentina. His most recent book, co-authored with Gustavo Fondevilla, is Prisons and Crime in Latin America, which is about to be published by Cambridge University Press. I think it's due out next month, so look for that. Professor Bergman writes on a variety of issues that are related to crime, public security, illegal drugs, as well as looking further back a little bit, has done great work on taxation, compliance, and the rule of law. Professor Bergman is a visiting scholar at Dr. Class this semester, and we're very, very pleased to have him. Finally, last but certainly not least, Jessie Bullock is our discussant. She is a PhD candidate in our government department here at Harvard, where she studies comparative politics and political economy. Her research interests include political violence, organized crime, corruption, and machine politics. And her dissertation book project, which is entitled Machine Gun Politics, looks at why politicians and criminal organizations cooperate peacefully, focusing mainly on the city of Rio de Janeiro, Brazil. So I'm really, really thankful and pleased to have all four of you here today. Before I hand the mic over, real quickly, a couple of housekeeping items. First of all, we are recording the webinar today. It will be available on the Dr. Class, the famous Dr. Class YouTube channel. Shortly after the session, we will, if you register for the event, we will email you a link to the recording so you can watch it over and over again. Secondly, if you've got a question for a panelist, we are happy to transmit it. Send it through the Q&A function, the Q&A tab at the bottom of your screen. I will, and my colleagues will be collecting the questions and will transmit as many of them in the Q&A session to the panelists as we can. So feel free to submit a question at any point during the talk. I've asked each of the panelists to speak for about 12 minutes. We're going to go in alphabetical order. And then Jesse, the discussant, will speak a little over 5 minutes. That should leave us 35 or 40 minutes for discussion and Q&A at the end. And during the Q&A, Fran and Alicia and I will rotate in asking the questions. And I'll try to close around 1:20 or 1:25. So we begin with Professor Bergman.
Okay, good afternoon. Thank you very much to Dr. Klaas, to Stephen, Francis, and Alicia for the invitation to participate in this webinar. I'm also very happy to share the screen with David and Ben. In the next 10 to 12 minutes, I will overview 3 salient issues of the current prison crisis in the region. First, I will highlight a couple of points to explain how we got here. Second, I will make brief remarks on how COVID may have changed and impacted the incarceration trends and conditions in the region. And third, I will conclude with some reflections about the future of incarceration. So let me first make 2 short but very important points about the type of mass incarceration trends we are witnessing in the region. First, the current trend is the result of government responses to the rising crime during the last 2.5 decades. Every Latin American country experienced growing criminality, and every country has had an increase in the number of inmates, doubling and in some cases even tripling the number of inmates over a span of 20 years. Despite modest investment in new facilities and infrastructure, the overcrowding is overwhelming the systems, and most countries face very severe imprisonment conditions. So let me share very briefly I hope you can see this. Are you able to see it? Okay. A significant number of arrests from petty crime and drug transactions. I mean, all the people that got imprisoned were, not all, but most of them, were arrested for small crime transactions. In an upcoming book with my colleague Gustavo Fondevila, we show that this type of small value transactions account for between 70% and 80% of all yearly admissions. From surveys conducted in 8 countries of the regions, we know that the median value of the thefts or drug transactions are very, very low. As you can see, the median transactions of illegal drug felonies were $429. Even if it's double, it's still very low. Since sentences for this type of crimes are relatively short, about 2 to 4 years, therefore, even if today there are 1.6 million people behind bars, we estimate that in the last 15 years, close to 3 million people have served at least several months in a prison facility. So the growth of prison population is flow-driven rather than stock-driven, creating severe problems of reentry, of high turnover of youngsters, further marginalizations, very high recidivism, severe impact on families, and unabated petty crime environment. The most important conclusion to which I will come back later is that the flow of new and recidivist offenders will continue to pack prisons. The second topic I want to address is how COVID has impacted prisons. From the Centro de Estudios Latinoamericanos sobre Inseguridad y Violencia, we have coordinated a regional effort with 32 scholars from the region and put a report for the early months of the pandemic. I show here some results. As you can see, the impact of COVID on normal life in prison was significant, while the true number of deaths and infections from COVID is probably well undercounted. Violence and fear initially grew. Things have not dramatically changed since last August. So there are two salient issues here we need to track. First, the family visits and the provisions of goods from the outside, both legal and illegal, were severely cut. Since families are key in supplying food, medicine, and illegal drugs, someone else has to supply these goods. To reduce riots, prison authorities have most likely allowed smuggling these goods into prisons, perhaps prospering illegal markets and strengthening the leadership of inmate groups and gangs. Over the last month, the provisions of goods by relatives were reinstalled. It appears that by solving these critical issues, authorities were able to avoid major riots and violence. The second important topic from the COVID perspective is the effect of overcrowding. Initially, some prisons administrators and judicial officers were seeking to reduce the number of inmates by taking advantage of COVID, using it as an excuse to reduce prison population. This had different outcomes, but overall, as shown in the previous slide, the reduction of the number of inmates by different programs such as early release and house arrest were very modest. By August 2020, we estimated that no more than 5% of inmates benefited from these programs. The impact on overcrowding has not been significant. Recent data indicates that prisons are filling back to the pre-COVID levels. And this leads me to my third point I want to discuss. What is to be expected in the coming months and years? I believe that unless a significant shift in incarceration policies are launched, things will not change and perhaps will even get worse in some countries. Let me briefly explain three current trends. First, the large illicit markets in the region that lure so many youngsters into dealing with drugs or raw consumer goods for supplying secondary markets will continue to prosper as economies worsen. This implies that, that more people turn into petty or medium-sized crime, and we are seeing this. In a worldwide project of the effects of lockdowns on crime that includes 9 Latin American cities, we have found that there was a significant drop in property crime and violent crime during the first few months of the lockdown. You can see the reduction here, the table. In an initial analysis, I am finding that most of significant drop occurred in many cities of Latin America. For example, and I wanted to show this, robberies in Lima decreased by 87%. This, of course, and that happens in other cities as well. This, of course, reduces the pressure on prisons because, at least temporarily, admissions drastically dropped. But crime in Latin America went back to normal pretty soon. And recent data indicates that current rates of property crime appear to be even larger than before COVID. In short, crime is back and perhaps even at larger rates. Second, the economic impact of the pandemic will clearly reduce investments in prisons at the time when there is even more need for spending. This is pretty much self-explanatory. Prisons are not the main concerns of policymakers, and spending will surely be prioritized in social policies and direct transfers for population in need. In some countries, for health considerations, vaccination programs and sanitizing measures will be instrumented in some prison facilities, but most likely vaccination will reach jails rather quickly because, on the other hand, reducing the overcrowding will be even much more difficult to achieve. And third, this is my last point, it relates to the political willingness to launch prison reform. A lesson we can draw from COVID is how difficult it is for judges and policymakers to launch measures that depart from stiff punitive policies. According to polls, the few early release measures and programs in most countries were soundly rejected by public opinion. Understandably, policymakers were gun-shy in pursuing further modest steps to alleviate pressure. In short, post-COVID does not appear to present a fertile ground in order to bring more rational sentencing and prison reform. Thank you very much, and I apologize for the share screen problem. Thank you.
Thanks, Marcelo. You were a real soldier. Okay, our second speaker is Ben Lessing.
Thanks, Steve, and thanks, Marcelo. Congrats, Marcelo, on the book. As you know, I'm a big fan, and I'm very happy about the work that you and Gustavo can do. Really bringing one of the kind of, I think, first systematic, comprehensive, comparative studies empirically of prisoners across Latin America to an English audience. I just think that's an English-speaking audience. So I want to congratulate you. I don't have a fancy presentation to give, and it in some ways reflects the fact that, as far as I can tell, I'm in Brazil. I've been here for most of the pandemic, and there's been a number of surprising, things that have happened over the last year. I mean, not least of which is I thought by spending the pandemic here in Brazil, whatever the health risks would be, that I would be at much greater risk of a kind of some sort of political instability or military coup than if I had stayed in the United States. And it turns out, actually, the government here is pretty stable, relatively speaking. But among the other surprises has been, unexpected outcomes, there's been a number of them. Obviously, Brazil is very high lethality case in terms of COVID, and like the U.S., had a very terrible top-down management for a long time. At the same time, the way that the disease has spread has in many ways defied expectation. So when I go back to, almost a year ago when this all began, there was a great deal of fear about the prison system and a great deal of fear about, favelas, where, the feeling was these are places that are, prisons are overcrowded by definition. There's limited ability for people to isolate. Hygiene, there's lack of access to proper hygiene, and a host of other factors. And the reality has been, the tragically high levels of contagion and lethality from COVID have not been concentrated in at least in Rio, in low-income neighborhoods. And the prison system has been a big surprise across a couple of dimensions. So I'm just looking at the most recent data, the Brazilian, I don't think it's the government, I think it's the National Conselho Nacional de Justiça, which I think is, I'm not sure if that's part of the government or if that's a separate part of the Bar Association, but they've been regularly publishing data on this. And I'm looking at the January 2021 data here, and believe it or not, in the entire Brazilian prison system, including staff, including guards, there are 57,000 confirmed cases. If we just look at prisoners, there are 43,800 confirmed cases. That's in a prison system that, as of the end of 2020, has 773,000 prisoners. Right? I actually found that out from a Bolsonaro tweet where he tweeted that the number of prisoners had gone up by 5% over last year, and so that's 20,000 more bandits who are not on the streets, according to Bolsonaro. So I can just parenthesize for a second and say, like Marcelo, and I think like many of us who study issues of mass incarceration, it's a hard thing to study in countries that have sort of invested in mass incarceration, because that political dynamic seems to never end. There always seems to be politicians who can make hay out of the fact that, you know, the prison population is growing, and that's obviously a good thing because we're catching the criminals and we're putting them away. And obviously has not gotten rid of crime or violence in Brazil. But I'll circle back to that in a second, about the sort of structure of crime, the domain of crime, the world of criminal governance in Brazil, which is what I've been here researching and writing about. It's all based in the prison system. So when the COVID epidemic began, there was a kind of there was sort of, you know, you might have thought this is going to shake everything up. This is going to shake up not only the way prisons are run, but the way crime is organized within the prisons, and then therefore the way that the entire urban periphery of most Brazilian cities is organized, seeing as in the last 10 years, prison-based criminal organizations have expanded and sort of divvied up the urban peripheries of most of Brazil's largest cities, following on and adapting models of criminal organization that began in São Paulo in the 90s and Rio in the 1990s. So you might have thought that COVID was going to be like a, you know, a bomb that would sort of mark a before and an after, or that it might wipe out the prison population or any number of things. The reality is the cases have been surprisingly few. And the deaths registered are very, very few. 229 deaths, including agents throughout the country. And of prisoners, there are 130 registered deaths from COVID. Now, maybe there's underreporting, maybe some people died from other things, but that, by any standards, I think, is a very low number. That's something like less than one. I think it's 0.04% or something like that of the prison population lethality. So that is, I think, by any measure, success, right? Given all of the conditions that were there, as Marcelo suggested. So you have massive overcrowding, poor hygiene, and above all, you had the suspension of visits, right? And as Marcelo mentioned, visits are where many, many prisoners get necessary hygiene and toilet paper. In the case of feminine prisons, where they get feminine hygiene products, the state doesn't provide these things. So I wish I could tell you that I had visited prisons and could tell you exactly how they got around the restriction on visits, and, you know, where were the drugs coming from and where were all these products coming from. I honestly don't know the answer to that question. I believe, as Marcelo suggested, that, you know, modus vivendi were agreed on in various ways. And I'll just take this opportunity to sort of, you know, as I'm here at Dr. Class with this sort of brain trust of people, I'll just take the opportunity to sort of openly, you know, scratch my head and puzzle about what strikes me as a real puzzle in a sense. You know, I know in a few specific cases, like the state of Ceará, or the state of Rio, that in different ways, the prison administration worked with the prison gangs to kind of come to an agreement. For example, in Rio, they sat down very clearly with the leaders of the Comando Vermelho and the leaders of the Terceiro Comando, and they explained the nature of the virus, and they got them on board with the no visits policy and a series of other policies. And they even got them on board with some of the hygiene and lockdown policies that initially the Comando Vermelho and other groups helped enforce in the favelas. And I know, for example, in Ceará, quite the contrary. The government there had an anti-prison gang sort of stance and wouldn't negotiate or work with them at all. And so it did its own thing, and it was in the process of mixing. Together prisoners from different gangs and sort of forcing them to live together under a regime of sort of extreme, rigid procedure and high guard presence. It's very violent, but ultimately effective in a sense government plan to sort of break the control of the gangs over the prison system. And that plan, you know, seems to have been moving forward throughout this COVID period, and the government just on its own implemented all of these COVID procedures that, equally as much in Ceará seems to have reduced the potential level of infection. In other prison systems, they're far more opaque, like Amazonas, for example, where it's mostly run by private companies who the state contracts out to, and so they're very opaque about their operations. But Amazonas has registered 1 prisoner death. And this is obviously a state that's made headlines in the US for the total collapse of the health system and the very high level of infection and lethality affecting people in the state as a whole. So I'm kind of, I just, as a first pass at this, my take is that, the prison systems in Brazil, they're state run for the most part, have been effective at controlling COVID. It seems like it's been through the implementation of no visit policies and strict testing, using the available resources, the available space to isolate people when necessary. And as a kind of a theoretical level, my conclusion is, well, COVID is something that cuts across lines, right? In the favelas, we saw that it was both in the interest of the gangs and the state to impose lockdown measures, and they often cooperated in that. Well, in the day-to-day operation of prisons, COVID was something that was equally scary to guards and to prisoners. We do hear places of prisoners, protesting the end of visits, but in many places, the prisoners themselves were totally on board with that. They didn't want their family members being exposed. They didn't want to be exposed by other people's family members. And above all, they didn't want their family members afraid to come because of fear of exposure. They didn't want to set a precedent where, visiting them would seem to be high risk. And so at the same time, the guards and the prisoners both know that they're equally at risk of infecting one another. And so something that I've seen in other contexts in my work, where in many ways I've come to see prisoners and guards as co-workers. They often find ways of working together to sort of get the job done of making prison life livable for everybody. It seems like, as a kind of a tentative assessment, that has played out in the case of Brazil and led to these very low infection rates. And the lack of, we haven't seen, this is a country that had very violent prison massacres as in 2019, prior to the pandemic, and in 2017. This is the country that's had prison breaks and all manner of prison violence, and the COVID crisis has not exacerbated those aspects of mass incarceration in Brazil, as far as I can tell. I think it's absolutely critical to try to do some comparative work with other countries and understand if this is a general phenomenon or if this was something unique, and to what extent the factionalization of Brazil, right? The fact that this prison gang model has taken over really the entire country. So really, these kind of powerful prison gangs that began in Rio, expanded to São Paulo, and then took over most of the country. To what extent that has been kind of critical in facilitating, what I'm sort of inferring was some kind of cooperative operational agreements that led to these low levels of infection. So I think that's probably all I have to say for now. I'd happy to talk more about the broader issue of these, of the way that prison gangs have, sort of colonized the urban periphery of Brazil, but that's, a topic perhaps for another day.
Great, thanks, Ben. Next speaker is David Scarnett. David, you there?
All right, well, good afternoon. It's nice to be in conversation with Marcelo and Ben and Jesse. I guess in order to understand the response of Latin American prison systems to the pandemic, I want to sort of step back and look at it from a comparative perspective. In my work, I've argued that to understand life and work in prisons, you need to really understand official institutions and also extra-legal institutions, as Ben was very eloquently discussing. So today I want to sort of think through this question of how do the interactions between extra-legal and official institutions affect pandemic responses? And in particular, I want to look at examples of ways that choices with respect to those two types of institutions years before the pandemic have constrained the way that both types of groups can respond to the pandemic today. So there's a sort of path dependency issue involved in the cases that I'm going to look at. We all know the sort of public health advice today. Try not to interact with people, maintain social distance, wash your hands frequently with soap. That's very simple advice, but for many prisoners, it's not so simple to implement. Prisoners lack autonomy and resources. They can't choose who to live with, where to live, or who to interact with, and they're very constrained in their ability to access goods and relevant resources. A second thing that hinders the implementation of this advice is that the prison systems in which prisoners live have responded in very different ways and with a great deal of different capacities. This is a maximum security prison in Norway. I hope that this picture gives you the impression that the prison system is run with a great deal of resources and capacity. They provide order, amenity, and services at a very high level. In addition to having that capacity, Norway was privileged in the pandemic, again, by decisions that they've made decades and years ago. The first is that they operate their prisons along a model of having relatively small prisons. So on average, Norwegian prison facilities only hold about 80 people. Smaller populations, less interactions between prisoners and staff, easier to fight the pandemic. They also don't have any overcrowding in their prison system. At the start of the pandemic, they were at about 90% of design capacity. That's fallen to about 73%. And an important implication of it is that when there's no overcrowding, almost universally, prisoners have their own cell. That means that they are socially distanced from other people for the vast majority of their day. Finally, Norway had the advantage of not having significant entrenched extra-legal institutions like the prison gangs that Ben has discussed. As a result, there wasn't a countervailing force or power that was fighting against or working with prison officials. So when Norwegian officials responded, like many places, they recognized the importance of reducing the prison population, both in order to limit the number of people that prisoners are interacting with, but also not to put people into, basically a very dangerous setting for a public health crisis. They also used their resources to increase in-cell programming for educational and vocational training. This was previously done in group settings, which are obviously inadvisable now. And so they wanted to make sure that prisoners continued to program and had things to do while sort of isolated in their cells all day. And they've also distributed hundreds of tablets to prisoners so that they can spend time in communication with friends and family on the outside. And so prison officials felt that this was very important from a sort of mental health perspective to allow them to maintain relationships in such a dangerous and frightening time. So the way their prison system operates and the lack of entrenched extra-legal institutions affected their ability to roll out these types of responses. In California, this is a California prison, they don't provide the order, amenity, and services in the quality that Nordic prisons do. And because of the way they've designed their prison system, they're less capable to respond to the pandemic. So California bases its incarceration system on a relatively small number of very large prisons. At the start of the pandemic, the average prison in California held about 3,500 people. That's down to about 3,000 now. And in addition to prisoners, there's of course, anywhere from 700 to 1,500 staff and custody workers who are interacting in there. So these are fairly large communities. In order for the prison to operate, in order for people to get fed, even though prisoners are isolated, they're still interacting with lots of people. So these larger prisons are dry tinder for the flames of the pandemic. We've seen this in particular in San Quentin prison, which has incredibly high rates of fatalities. The prison system is also overcrowded. At the beginning of the pandemic, California had so many people that they were about 130% of the design capacity of their population. That's gone down, to my surprise, frankly, to about capacity, but there's still a lot of variation across facilities. So the most overcrowded prisons still have about 140% of their design capacity. In addition to that, meaning most people don't have single cells, In California, many prisoners are housed in dormitories, open air dormitories where social distancing is simply not possible. California is operated along a dorm model, partly because it's cheaper, but right now they're really feeling the cost as a result of it. They also have to deal with entrenched extra-legal institutions, in particular highly organized, racially segregated prison gangs, which confounded the officials' ability to respond and the speed with which they could respond. So California, like many other systems, has worked very hard to reduce their prison population. They've reduced it by about 21%. They first fumbled in the pandemic when they basically had a very slow rollout of PPE equipment, and in particular hand sanitizer and cleaning products. They felt that the gangs would distill alcohol from the hand sanitizer when they didn't want that to happen, and they feared that the cleaning products would be used as weapons against other prisoners and staff. So again, the prison system that California decided to work with and the presence of extra-legal gangs affected their pandemic responses. Now, Latin American prisons, as has already been discussed by my two competent panel members, are a very different beast than the two that I've described. If we look at the continent as a whole, they have a sort of a medium range size of prisons on average, but it's the range and the variance that really matters here. There are many prisons that have thousands of people in them and are thus, again, further tinder for the pandemic. The characteristic that's maybe most essential to Latin American incarceration is the level of overcrowding. It's not uncommon to find prisons with double or triple the design capacity crowded into very small cells. Again, this is a striking and disadvantageous situation when in a panic. More generally, their prisons tend to be understaffed by people who receive relatively less training than in other countries. Prisoners are plagued by extreme poverty, and they lack access to competent health care. As a result of this, a failure of officials to govern well, as mentioned, there's a proliferation of extra-legal governance institutions that come into existence to provide resources to administer the prison and to govern social and economic activity. These are just some of the examples in the existing literature of forms of extra-legal governance in Latin America. They vary in efficiency, desirability, and criminality, but their names give some indication of the intended purpose for them. Their directors, their inmate police, their delegates, their committees of order and discipline. This proliferation of extra-legal governance is the result of the failure of official governance to provide resources, administer prisons, and to govern. As discussed, prisoners rely heavily on outsiders, friends, and visitors for basic necessities, key resources. One study finds that 90% of respondents rely heavily on families for food, 85% for clothes or shoes, 64% for money, 50% for medicine. So the outsourcing onto incarcerated people's families of providing resources is a crucial weakness here. The prison system itself now, I'm reading, has only about 30% of them have the ability to test for COVID. And to the extent that prison lockdowns have eliminated visits, it's a crucial weakness in the way in which Latin American incarceration works. It may be fine in a non-pandemic world, but during a pandemic, it creates a substantial disadvantage. As discussed, there's been a series of disturbances and riots in response to some of these concerns. But I found as well in my study of Bolivian prisons that even when prison officials don't control and regulate life on the inside of these prisons, that the prisoners can invest in extra-legal institutions that operate in the sort of economic, political, and social realms. And in this particular prison that I discussed in some of my recent work, as mentioned in the Brazil case, it was the prisoners themselves who wanted a lockdown. They wanted to shut down the visits to protect themselves. Likewise, they've turned what were normally punishment cells into 14-day quarantine to lock up newly arriving prisoners. So, as I found in many studies, the prisoners are in a very disadvantaged situation, but they're not passive recipients of what the state is doing to them. They work in an active, proactive way to try to improve their situation. So, my basic point is that, pre-pandemic prison social order and social systems have a substantial effect on whether and how officials can respond to crisis. The presence and organization of extra-legal institutions matter in ways that I hope, will come to know in the following years. In Norway, extra-legal institutions are unimportant and didn't serve as a constraint at all, although we're also not there to aid in the officials' response. In California, the extra-legal institutions have a real dominant influence on the everyday life of the prison, but because prisoners only turn to the gangs for the sort of illicit substances, drugs, alcohol, tobacco, they don't turn to gangs for access to basic necessities like food. In the pandemic, that locking down of the gangs didn't necessarily cut them out of their sort of main avenue for key resources. And in Latin America, as discussed, the extra-legal institutions are pervasive, and something's going on because the prisoners are still alive. They're still being fed. They're still getting access to resources. But it, I think, highlights this problem with extra-legal institutions, which is that they're often not very robust, right? A shock comes along, something that worked well informally isn't robust enough to adapt and persist through challenges. And so I think we should think going on in the future, whether it's acceptable for Latin Americans to be based so much on a sort of outsourcing to prisoners' families and extra-legal institutions. Thank you.
Thanks, David. Okay, as a discussant, we have Jesse Bullock. Jesse, you there?
Hi, Steve. Thank you. So thank you to all of the speakers. I just want to underscore that these are really fabulous insights for bringing to light some of the vulnerabilities that the incarcerated face and the risks that prison gangs pose. Because it really focuses us to focus on the formal and informal institutions that are present in light of COVID-19 and are changing really rapidly underneath our feet. And to begin, I just want to start with a quick story from a woman that was very helpful to me while I was doing some dissertation fieldwork in Rio de Janeiro. She was a ex-wife of a drug trafficker who was incarcerated, at least for the latter part of their relationship. And in addition to telling me many stories about the way that politics worked in her neighborhood, she also shared a lot of really interesting details about the way that her and other women in their community would often organize to go and to visit their incarcerated partners or family members. And the amount of organization and attention to detail that they put into waking up at 4 a.m. to go all the way across the city to organize and make sure that everyone had enough money for catching 3 or 4 different buses, that everyone knew what the rules were for what was allowed to bring in or not allowed to bring in, was really remarkable. And it just really showed to me how detailed some of these family members that are having to go and visit their incarcerated loved ones have to plan, basically sacrificing maybe an entire Saturday or an entire Saturday and Sunday to be able to go and pay these visits to the incarcerated loved ones. And in thinking about this, I want to kind of pull on some common threads that all of the speakers mentioned related to the prison world and the outside world. And something that I want to highlight in my comments is the intersection of these vulnerabilities that prisoners and broad civil society that are connected to the prisoners face. So I'm going to push us to think about 3 broader themes that come out of these comments. And the first is really about the path dependence of the relationship to families, something that David just mentioned. On those that are supporting prisoners from the outside world, David gave us this really startling figure about how reliant Latin American prisoners are on their families. And, I could imagine that it would be easier for some of the incarcerated in Norway to adapt to using the technologies to communicate with their loved ones with a tablet or some type of communication via the internet. But I was wondering how resistant to these types of changes prisoners or some of the families on the outside world were in some Latin American populations that might have been lower capacity and probably didn't have access to some of these high-tech tools to serve as a substitute for still staying in contact with their loved ones. I know that that's a little outside of the scope of the work that you presented, but I also wanted to ask as well what you thought the effect of the lockdown was on visits and the absence of visits on the broader communities of people that support the incarcerated, and what these individuals might be missing from not being able to go and see their loved ones that were in prison. The second question I have is about the implications of no visits to prison for criminal governance strength, and for some of these prison gangs either growing stronger and consolidating, or perhaps growing weaker. And I was wondering if the no visit policy maybe is not only just containing the spread of the virus, but could have some effects undercutting the legitimacy of the prison gangs too. In other words, independent of COVID, are they missing anything by not being able to communicate by the rank and file associates that are out on the streets, or some of their families or caretakers that might be bringing them the necessary hygiene items, but also where they might be strategizing with making sure that they are that the rank and file are still performing according to plan, and if this is undercutting or making anything more challenging for them to continue to govern on the streets, but from behind bars. And lastly, the idea that the majority of inmates are in prison for short sentences that Marcelo brought up was really fascinating. And I want to think about some of the contextual factors that complicate this even more in the presence of COVID-19. And the first issue is that I saw on the slide that the early release and house arrest figures were quite small. But I was wondering if we knew anything else about sentencing norms, or maybe changes in policing discretion, things that weren't formally codified in law, but if there were any changes in behavior, despite not being any formal structural changes. Maybe if police, realizing that overcrowding in prisons was a problem, and an increasing problem because of social distancing, if they lowered the rate of performing these low-level drug arrests, or anything like that, that we might be able to observe about changes in norms and behavior. The second is that being in prison was already likely a bad experience before, but if there's anything that we could relate to this, to some of the classic literature on deterrence, or on any one individual's likeliness to commit a crime. I see that the property crime statistics are way down compared to what they were before the pandemic, but it's hard to conflate this with just the absence of people to rob from or to steal from as well. And I was wondering if you had any insights on criminal behavior, or any hypotheses or conjectures about possible deterrent effects of COVID-19. And the last contextual factor I want to raise is just, what do we think that governments are supposed to learn from this? Learning that there have been very few changes to formal institutional rules, and that despite this, we have seen in some areas crime go down. In others, in Latin America, of course, we have seen some rates of violent crime go up. But broadly, what are governments supposed to learn from this, given that we will be in the pandemic at least for several more months? I want to leave a lot of time for questions. So wrapping up, I would love to hear your thoughts on, how this will affect the relationship between families and prisons, what this means for criminal governance growing stronger or weaker, and then some of the contextual factors about law enforcement and punishment amidst COVID-19. So thank you so much for sharing.
Thank you, Jesse. Let me toss just a small handful of additional questions out of you guys, and let you guys respond, and then we'll do another round at the risk of throwing too much at you. One, I wanted to ask the group how much we know. I'm still blown away by Ben's point that at least as far as we know, that the infection rates and the death rate have been so low in Brazilian prisons. One question I had about that is, I was also struck by David's figure of 30% of Latin American prison systems having testing capacity. If that's right, that does lend credence to the possibility, then, that there's just dramatic underreporting going on. But assuming that that's broadly right, what do we know more broadly in Latin America? Is Brazil an outlier, or are we seeing surprisingly low levels of infection and death in other Latin American prison systems? Maybe that none of you guys know, but if any of you have any insight, I'd love to hear it. Two other questions, or maybe three. One is building on what David ended up with, the fact that virtually all Latin American prison systems are governed heavily by these informal extra-legal governance structures. The pandemic and the no visits policy was a major external shock. Could you, just building on Jesse, could you tell us a little bit more about, maybe it's a little early to know, but what can we say about outcomes? What can we say about how these informal governance structures have strengthened, weakened, adapted in response to this shock? And does it matter if there are divisions among gangs? I mean, I assume that there's some variation in prisons about whether gangs enjoy sort of monopolies or not. In this shock, this question definitely goes for Ben as well. Given this shock, what's the level of cooperation across gangs? Finally, a question from the audience. One of our audience members wanted to know and asked Marcelo and Ben whether they could recommend, or what literature they could recommend on illegal drug networks, illegal drug markets, prisons and prison gangs in Latin America. And don't hesitate to toot your own horns. You guys can each respond, and then we'll go to another round. Why don't we go in the same order, Marcelo? Don't forget to take up Jesse's question.
Thank you very much. Can you hear me? Okay. I'm sorry for the disconnection. Well, thank you very much. I think the wonderful presentations and good questions. I will just answer a few of them. In terms of Jesse's comment about the role of families, the total prison population in Latin America, but they are pretty much left. The situation of women, the pieces of information we do have is that the connection to the outside world that was minimal before is practically disappeared for most of them, which constitutes a very tragic situation, because most of the support came before COVID, and right now that support was cut off. So this is something that we have to monitor, but there is a plausible hypothesis that the situation of women in prisons became even worse under COVID than for men overall. Seeing or whether COVID or the idea that they didn't want to pack prisons, so police aggressive behavior, and I would say that there is we don't have evidence on that. That is to say, the dramatic reduction of crime occurs because of the lockdown. Indeed, it was because of opportunities that were reduced to commit street crime. Yet crime went back pretty much to normal after 3 months. So your the reduction in pressure, or the reduction in capacity, not capacity, overcrowding. Overcrowding reduced not because many people were released from jails or prisons. Indeed, some were released by early release or house arrest, but the majority of the reduction came from, as far as we know right now, came from reduction in new admissions. A lot of people, crime went down, so consequently, less people uh, were admitted to prisons, particularly in the case of Latin America, where, as I show, 80%, 70 to 80% of the admissions are for petty crime that are committed in the street. So this type of reduction immediately impacted on the reduction of overcrowding. But since, as David mentioned, we were about 170% of 70% over capacity. The impact, even if it's a reduction of 10 or 15%, we still are very much in a situation of overcrowding. I believe it's really, really severely undercounted. We don't have stats. We don't. Many cases are. Many diseases were from COVID and were assigned to other type of diseases or other categories. I think we still lack a very good number for countries. Perhaps a few countries do have, I don't know. But what we found out in our study we have made is there were extremely very low numbers that were impossible to believe. Countries, let's say Colombia reported 20 infections the first after 2 months. It was completely impossible. I will be skeptical about the official numbers on infections and diseases.
Ben?
Thanks, Jesse, for your comment. Also, congrats to Jesse on the crossword puzzle I see behind you there. I saw that on Twitter. That's totally awesome. Huge Sunday crossword. Well, look, I don't want to glorify something, and then later on it turns out that there were thousands and thousands of hidden COVID deaths. They're a measurement issue. I don't have it at my fingertips, the total number of deaths in the prison system, but that's a hard number. Someone dies in the prison system, total number of deaths. State prison systems are federal government, so sort of people on both not hiding the numbers, watching the numbers. Also, right, and there's a sense in which, especially early on, the prison administrators themselves, you might think they wanted to hide the numbers, but in many ways they didn't. They wanted more resources. They wanted more attention paid to the prison system. They were arguing for hospitals to install. So in general, the incentives for them to hide the numbers, I don't think where they were. One important explanation I forgot to mention, is tragic in its own way, is that the Brazilian prison population is far younger than the population as a whole. It's mostly kids, mostly people from the ages of 18 to early 20s. So that's not a high lethality group. And that's also probably true to some extent for the favelas. I'm not a public health guy, but favelas tend to have a younger population, I believe, on average, or at least I think that's true here. So I think that's another explanation that people have floated around. The thing about the governance structure, I don't have an answer. I don't know exactly, but this is my sense. So, just talking to a couple of, and again, I certainly haven't been able to visit any prisons. I haven't been able to speak with prisoners, and obviously family members haven't been able to go. I don't know researchers in Sao Paulo who've even been able to visit the prison system prior to COVID, much less during COVID. So I don't think, to try to understand what's going on inside a PCC-controlled prison in Sao Paulo, I would love to read accounts of that. I personally don't don't have access to that. But my sense of from talking to people at Rio was, and I think this is an interesting, you know, it's great to have David here and have me in dialogue, because I think it's not clear to me that the presence of extra legal institutions I think it can kind of go either way. Obviously, it gets in the way of the state doing whatever it wants. But in some places, I think, and particularly these kind of prison systems like Rio's, where these gangs have been around for 30 years, they're segregated by gang, the units are segregated by gang. So this whole unit is all commandable measure. This whole unit is whatever. The gangs themselves impose a lot of the order-making rules around how visits are going to work, around how guard-visitor interactions are going to work. They work together with prison directors over the years to develop these relationships that can, I'm telling you that I've seen this firsthand, they can be collegial relationships where the director of a prison or the head of security of the prison, I don't want to say he's friends with the prison gang leader, they're not friends. And, you know, they have a relationship of one has, you know, extreme amounts of power over the other one. But, you know, that's true in the workplace. And so in some ways, it's not that different from a workplace relationship where that, yeah, the prison director can make that guy's life awful, but he can also make the prison director's life awful. So when those structures are in place and prison directors are used to working with those gangs anyway to deal with issues as they arise, at least it seems like in the case of Rio, there was a meeting of the mind, and that was effective, and I believe was part of why we saw at the very beginning of the pandemic in Rio, a number of the larger Comando Vermelho controlled neighborhoods having these like aggressive, I don't say aggressive, but quite, you know, the gangs getting very much involved, right? Not just, you know, enforcing lockdowns and curfews, fighting price gouging in markets for, you know, for alcohol gel and things that were getting too expensive. So that kind of engagement, I think, kind of fell by the wayside as the lockdown in general did in Brazil, as people got sick of it. But that initial engagement that I saw here in some favelas in Rio, which frankly, we didn't see as much in other places as we expected. So when we think about this Medellin project I'm involved in, most of the gangs in Medellin didn't really want to get involved in trying to enforce a lockdown. Maybe they would sort of, you know, help out here and there for poor families like they always did. And sort of as I collected stories from around Latin America, stories of gangs getting involved in COVID lockdowns were sort of few and far between. So my feeling was like, look, you know, this is not fun for anybody. No government likes to tell its people you're not allowed outside, you're not allowed to walk around, you got to wear a mask everywhere. This is not a fun function of any state. Right? You have to use all of your power and coercive powers of state to get people to do something that they don't really want to do. And so I think gangs were kind of like, you know, they had this initial burst we saw in Rio, I think, kind of was, I mean, at least I think it's plausible or it's correct. You know, it's consistent with the evidence that the prison-based leadership, you know, bought the story. They bought they understood the issue. They understood how the need for these measures. They were on board with it, and that they helped implement that both in the prison and outside. In other places, you know, my sense of things is that. You know, if there's a kind of a middle level where the gangs are chaotic and there's leadership battles and other things going on, you can't really depend on them. And the COVID thing is, you know, maybe it's decimating part of the leadership or something like that. I don't know. Then I think that's a situation where, you know, the presence of these gangs is just going to really get in the way of an effective response. The state can't do it on its own, and also doesn't have an effective partner with the gangs, something like that. I think that might be where you see the kind of worst case scenario. In this case in Ceará, like the governor of this, you know, the prison administration had already been embarked on this mission of breaking the back of the gang control of the prison. And those gangs in the favelas of Ceará, they became much more fragmented over this last 2 years, and also didn't do a lot of governance activities in the favelas. So in Ceará, those activities were mostly carried out by the state. The gangs just kind of, you know, laid low during the lockdown.
Thanks, David.
Great. Well, I certainly agree very much with Ben that gangs can very often work independently of officials and do a halfway decent job governing prisons. Sasha Dark's book on co-producing Brazilian prison order is another example that I think persuasively shows that gangs or extra-legal institutions can work together explicitly with officials to co-govern. I think what we don't know as much is what explains why the gangs are good and when the gangs are bad. When are they predatory? When are they, productive? And I've got a sort of Olsen stationary, bandit model in my mind that might explain it. But we certainly don't know. And we certainly don't know in the wake of the pandemic how these things are going to change. My guess is that criminal governance is here, for the time well-being. The poverty still exists in the world. Profits from the drug economy are still there. Gangs still have control. There may not be visits, but they have cell phones. They may not be able to rely on family to smuggle in contraband, but there's always correctional officers and prison staff who are willing to do so. I thought Jesse raised a very interesting question about, is there anything to learn about, sort of criminological theories more generally from this experience? That's very interesting to think about. I mean, obviously so much has changed during the pandemic. It's difficult to know what the appropriate comparison case is. But, we know that I think it's pretty persuasive that, the best ways to deter crime are to organize penalties so that they're swift, certain, and fair. And I'd say, amongst each one of those, they've become less so during the pandemic. I think the likelihood of being punished for committing a crime swiftly has gone dramatically down. So they're withholding pre-prison incarceration or pre-trial incarceration. So the swiftness of the punishment is slowing. I think enforcement of a wide range of laws is far less certain during the pandemic, in the same way that everything is so uncertain during the pandemic. I think that sending people into prisons during a pandemic is perceived to be much less fair. There's a public health crisis going on, there's a pandemic. And I think my personal opinion is that if every single prisoner is not single celled, then it's basically a human rights violation. So I wouldn't expect there to be more deterrence given how less swift, less certain, and less fair prison use seems to be today.
Fran, go ahead.
Okay, thanks. We have many interesting questions that have been dropped into the chat in the last few minutes. And I apologize on behalf of all of us that we're not going to be able to get to all of them. We should be ending in 10 minutes. So I'm just going to try to summarize a couple and then ask our panelists to keep in mind that we need to close. So the first set of questions that I want to ask are questions that one of our PhD students, Caitlin Criswell, has asked that overlapped with a line of inquiry that I wanted to raise, and that is the comparative, the richness of the comparative cases that you've all presented, and what this can tell us about what's working, what's not, and why. And Caitlin and I approached the cross-national or the cross-state comparison in Brazil slightly differently. Caitlin is looking out from the criminal gangs into the neighborhood. She's asking, if we think about Rio, if we think about Ceará, if we think about these very different models, can we assume that that the criminal gangs in these states were more or less interested in controlling the spread of COVID outside of the prisons and in their neighborhoods? Are gangs more actively trying to control the spread outside of prisons in Rio than in Ceará? So she's looking out from the criminal gangs out. I'm still stunned that we have these three dramatically different models. Criminal co-governance in Rio, a state imposition in Ceará that just throws everyone together, and private prisons in Amazonas. And we don't seem to see a lot of variation on the outcome. And, we can all agree that Brazil does not have the state capacity that Norway does. And so why? And Caitlin also asks the cross-national question. And she's explaining why Latin America is doing better compared to California. And she's wondering if it's the kind of extra legal governance that David mentioned, or whether it's something else. And we know how serious the problem has been in California. We know how much of the spread in California started in San Quentin. So this is a very important question. I guess my second question, I want to zoom out, because I think this would just be a really interesting opportunity for you all to opine about it and for the audience. And that is, Marcelo raised the question of the opportunities that there might be, but his presentation ended on a kind of depressing note that there didn't seem to be a lot of opportunities. Basically, public opinion is something that does not vary. There isn't a lot of public support for increasing investments in prison. Bolsonaro wins votes by saying he's going to throw more bandits in prison. And so when I think about where there are opportunities, I think about the impact that, and for those of you who know me, I'm not the first person to bring up social movements, but it's undeniable that the Black Lives Matter movement has had an impact on the way we think about incarceration in prisons in the United States. And we see the spread, we see the diffusion of these models, at least in Brazil, and I suspect elsewhere. I suspect Bolivia would also be a case where indigenous movements would also be making this case. Is this an opportunity? Do we see any social mobilization around prisons, especially as families can't see their loved ones? Is this a possibility? And Natalie, I just want to mention that Natalie from Argentina, Caneva, asks a very similar question. What is it that can be done to sway public opinion about prisons? And is this a moment that can be done? So there's like one opportunity would be social movements, another would be co-participation. Should there be more participation of prisoners in the governance of their own prisons? What would the trade-offs be there? I think I'm going to have to stop there. I apologize to everyone else whose questions I could not get to, and ask if you could all take no more than 2.5 minutes to basically a piece to answer. Thank you. Marcelo, we'll start with you. You're muted, Marcelo.
How about that? Are you able to follow me? Okay. Thank you very much for the excellent comments. I will just relate to the second question of Francis. I will leave it for Ben to respond to the first one that he's more of an expert about, and David. On gangs and prison governance. I believe that we are in a situation where it's very hard to promote sentencing reform. I think that the heart of the problem is that sentencing is that half of the people that are serving time can get into community correction type, and they are stuffing and they are overpacking the jails and prisons in Latin America without any solution that can be enacted pretty soon. So what can be the role of NGOs, social movements, groups, that there are plenty of them, trying to bring reforms or reduce overcrowding. I think that there is some room. They are doing certain they are bringing some positive measures. If you see groups in Argentina, in Uruguay, or in Chile, they are very powerful and they keep overcrowding relatively low. That is to say, women women organizations, legal human rights organizations, all are putting pressure to authorities to reduce overcrowding. And they are modestly successful. Yet I don't see the the overwhelming force behind it. Black Lives Matter was a very large movement. Here you have small groups with a lot of motivation, a lot of power, but the big majority of the population are against releasing inmates, and they are for stiff penalties. So politicians make sense for them to follow them. I just a very brief note. I sent my presentation. So when you, if you see the record of this presentation, you will be able to see my PowerPoint, and then you will see the numbers there. What I'm trying to put across is that once crime is starting to get up against at the same levels as pre-COVID, we are seeing again an increase in the number of inmates. That is to say, prisons are going back to the pre-level. Not yet, but they are in that direction. Thank you.
Ken.
Yeah, I mean, I wish that I wish that the COVID crisis, as much as I wish it had made everybody suddenly realize we need to do something about climate change, which apparently people are like, okay, now whatever, it's over, now we can go back to what we were doing before. It's also not going to seemingly have much of an effect on the dynamics of mass incarceration and anti-crime policies and so on and so forth. At least here in Brazil, it seems to me. There has been a fair amount of decarcerization and what they call progressão de pena. So a lot of people who were eligible to go from the closed regime to the semi-open regime, which are you're allowed outside more of the time, where you're in these prisons that are more kind of like arms. So a lot of people got moved forward in their or in a fair amount got to go on house arrest. But then there were some high-profile cases of drug lords getting house arrest and then disappearing, criminal bosses being released from prison for fear of COVID and then disappearing, and so public opinion's turned back against it. I think movements in favor of decarcerization and reducing the prison population here in Brazil have been strengthened, but not to the point where it's like a sea change or something like that. And in some ways, the low death rate works against them, right? I mean, there hasn't been a crisis at the level, the crisis of people not getting to have family visits, is a bad crisis, but it's not one that rises to the level where it's hitting newspapers and it's on the broader public's mind. So that's a troubling. And then with respect to the question of sort of public security and crime, again, you don't know what has to do with control of criminal activity coming from prison and what's just the general dynamics of life under a crisis. Homicides are down in Rio. Police homicides are also down, but still extremely high by historical standards. And so it's now reached the point where more than 1/3 of all homicides in Rio are committed by police. Just give you some sense of it. So, other forms of crime have been down, but then have gone up in certain moments, or they came down during the initial lockdown, but there's been an explosion as things kind of began to open up again. So, I think there's a lot of dynamics in play. And then even within those sort of police killings dynamics, people were like, oh, is this because of the pandemic? Is that going to lead there to be less police violence? It seemed like it might at first, then police, because they were busy doing lockdown activities, but then it surged, and it surged so high that the Supreme Court of Brazil banned police incursions, and then it dropped as a result of that ban. And so there's sort of dynamics, those kinds of I mean, that makes it extremely hard as a social scientist to say what's the role of, or public health, epidemiologist to sort of gauge what's the role of COVID.
Thanks. David?
Yeah, I have been hoping that a silver lining of the pandemic would be significant change in mass incarceration. And, the number of people in prison is a function of how many people we send there and how many people leave there. And, historically, for social and political reasons, it's a lot easier to not send people to prison than it is to get people out of prison once they're there. So what we have now is a crisis that gives political cover for states to reduce prison populations in a way that's good for public safety rather than bad for it. In California, in the last 11 years, they've cut the prison population by 40%. It used to be the largest prison system in California, and it's at it's lost 40% of its prisoners. Half of that is because the Supreme Court put an injunction on them saying that they had to do it. The other half is Gavin Newsom and a pandemic and political will to basically stop sending people to prison, but also take them out. And when you can use both levers, you can get that total size down much more quickly than you can if you're just stuck with reducing how many people go into prisons.
Okay, I have to close. First of all, I want to genuinely thank Marcelo Bergman, Ben Lessing, David Skarbek, and Jesse Bullock for a fascinating conversation. And secondly, just invite you back next week to join us for a great panel on Ecuador's presidential election entitled, Is the Citizens' Revolution Over? So we hope to see you back next week. Take care, everybody.